Hey YouTube, thanks once again for tuning in to our show, Morgellons disease discussion and microscopy videos. I'm your host, Jeremy Murphy, and joining us today is a very special guest, Doctor of Nursing Practice and author of Morgellons of a Disease, Dr. Ginger Savely. Hey Dr. Savely, how are you doing today?
I'm good. Happy to be here. Thank you for inviting me.
Thank you for being with us. Can you tell us a little bit about yourself and about your practice?
Yes, I've had a practice specializing in treating tick-borne diseases now for quite a while. And so it just sort of happened. I originally was in family practice taking care of primary care needs. But as I began to see more Lyme disease patients, I just gradually ended up specializing in that. That happens to a lot of us who go down that road. We may not start out intending to specialize in it, but we find that we do. And it's very, very interesting. And that's when back in about 2003, I started finding patients with the symptoms of Morgellons disease. And so I kind of developed a subspecialty in that, once again, not really intending to, but it just kind of fell in my lap, you know.
And so that led you to write this book.
Right. And so I finally, I get a lot of phone calls and emails and questions from healthcare providers, patients, and all over the world. And so I thought it would make things a little easier to put things down where I could the book, because I don't really have the time to spend talking to everybody who wants to talk to me. And so I felt like it would be easier just to get it all down there in writing. It took me a while to convince myself to do that. Yeah.
It's a helpful guide. It's been very beneficial in my journey. But of course, it's one part of the equation. And the other part is finding a practitioner who can utilize the information in the book. How can Morgellons patients find doctors like yourself who treat the condition?
Well, I think the first step is usually to try to find somebody who is they're often called LLMDs, Lyme literate MDs. When we say Lyme, we basically mean people who specialize in all tick-borne diseases. Lyme is just sort of the easy way of saying it, because all of the tick-borne infections tend to come together as a package deal. But I find that at least if you can find somebody who is aware of tick-borne diseases, open-minded about all that and trying to treat them, that's your best bet, because they are going to be, first of all, just more open-minded. And also because if they've been attending the Lyme conferences, we've been talking a lot about Morgellons disease in the Lyme conferences over the last several years and the association with Lyme disease. So anyway, that's always a good place to start. I realize that they're not even easy to come by either, though. But usually people can find a Lyme disease support group in their state, and they can talk to other people and find out who these people are. But it is often hard to find, because I have to say that most of the doctors who do treat unusual things like Morgellons disease kind of need to stay under the radar, because they worry about their license. And so because they're staying under the radar, it's hard for patients to find them too. It's simply a word of mouth thing.
Yeah, and even as the scientific data comes out, they're still reserved to address the condition because of that stigma.
Absolutely. Even Lyme disease, we know exactly what causes that, and yet it's still very, very controversial treating Lyme disease, just because there's so many people out there that don't believe that it's anything other than a very simple, easy to cure infection. So
that's of course not the case at all.
Right, exactly.
Does everyone have Morgellons? Is it an environmental condition?
I think that it might be, I don't think everybody has it, no, but I do think it might be just out there, fairly easy to come in contact with, but that only certain people succumb to it. Even we find that to be true even with Lyme disease, that some people get bitten by a tick, they even acquire the Lyme bacteria, but they never get sick from it. And we do know that there are certain genetic propensities for people to succumb to certain kinds of illnesses. And that's what we're trying to work on now in terms of Morgellons disease, because even the patients who have Lyme, we found that 6% of Lyme disease patients get Morgellons disease. Well, if there's an association between the two, which we're starting to suspect, but we can't prove for sure, but there seems to be an association between Lyme disease and Morgellons disease, well, then why do only 6% of Lyme patients get it? Well, there's got to be some sort of other key here, like probably some genetic predisposition. And so I think that's often the case with a lot of diseases that are out there, that just some people are going to be more likely to get them than others.
Now, that study that you mentioned, where 6% of Lyme patients present with Morgellons condition, what's the sample size of that study? Do you know?
Well, there were two studies. One was done in Australia, and one was done in San Francisco. Two different people, and it was interesting. They both came up with the same number of 6%. And the study in San Francisco used a couple of hundred Lyme patients. I honestly do not know the study in Australia, how big of a sample size that was. But it was kind of interesting that they came up with the exact same 6%. But
yeah, that is very telling. But of what it's telling, we're just not sure yet.
Yeah, exactly.
Do all Morgellons patients have clogged up pores, and what is the material that clogs them?
Well, I think that, yes, the thing is that Morgellons patients produce a lot of excess, proteins, and these things are not supposed to be produced in the quantities that they're produced and places they're produced. And so when the cells of the Morgellons patients start just overproducing different proteins, it makes sense that things in the outer skin would get kind of clogged up with excess junk, excess waste. And the fibers that come out, the filaments that come out, we have shown those to be produced. Those are made of keratin and collagen, which are the body's own proteins, so made by our body. But our body isn't supposed to be making those things in that quantity in those places. We're supposed to be keratin is definitely something that the body's supposed to be producing, but it's not supposed to be producing it in all over the skin and making filaments that come out of the skin. So I think that when you talk about clogged up pores, I don't necessarily see that, but maybe I think people describe things in different ways, and I think that that's what's going on, is just this excess production of matter. That's kind of a simple way to say it, but
typically inside lesions, there are little white bumps, protrusions. I've heard them described as follicular casts. And anytime we've sent them off to a lab personally, they've been reported as just being subcutaneous material, like you said, keratin and collagen.
Right, exactly, and that's what they are. And the big question is, why is this happening? Why are certain people who end up having this disease, why are their cells all of a sudden going awry like this and doing this? Yeah.
So when Morgellons patients are picking, what they're really doing is extracting material, their own proteins, but that's been irregularly produced and is causing pressure underneath the skin.
Absolutely. And, it's totally understandable. And I think a lot of doctors are saying that the picking is a psychiatric symptom, that people are just gouging at themselves for no reason. But it's very clearly, there's a reason for it. And the thing is, if you've got things underneath the skin that are trying to come out, that are causing pain and pressure and discomfort, of course, you're going to want to try to remove those things. And so it's understandable that people do spend a lot of time trying to extract those. I don't think that's a sign that somebody's crazy. I think that's an adaptive thing,
From personal experience, I know it kind of turns people off that instead of going to a doctor to get them extracted, it's a self-extraction process. Do
Yeah.
doctors do this process now that we have scientific data that legitimizes the condition?
No, they don't. They don't. And I remember one time I had a patient in San Francisco who he said that there's something in her thumb that deep down in there, and it was just hurting her so much, and she just wanted to get it out. And she insisted I send her to a surgeon. And so I did. I sent her to a hand surgeon. And I guess he did try cutting in there and he couldn't find anything, which led him to believe that she was crazy because he was not able to find anything under there. And so unfortunately, I think most doctors aren't going to go in there and start digging out something that they can't readily see. No.
Yeah.
And I don't know what to say about that, or why that's the case, or why they can't find these things. I don't know. I certainly know that when I would try to do biopsies on patients in my office, I would certainly have these very tough fibers in the patient that would go deep down under the skin, where I could not extract them. I just wasn't physically strong enough to do it. And sometimes I would even try to cut them, and it was very difficult to even cut them out. So I think it's very hard to extract these things possibly because they're just so deeply embedded.
Then they're really just a part of our body.
Yeah, they obviously go down to deep levels, but there's just no way we've been able to find out yet how. And, a lot of my patients really feel that these things are connected in a network underneath them, almost like as though they look like Spider-Man under their skin, as though they're these webs of these fibers that are connected. And there's just no way to know for sure whether that's the case. Yeah.
So what treatment has been demonstrated to work?
Well, the frustrating part about treating this is that every patient seems to be so different. And every time I land on a great treatment for one patient and I'm like, yes, this is it, then the next patient, it doesn't work at all. So who knows what that means, right? But generally, it's been a combination of antibiotics, antifungals, antiparasitics, antihelminthics, things that are designed to kill bacteria and viruses and fungi and even worms. Why these things are working, it's hard to know for sure, because after all, we don't even know exactly what we're targeting here. But since these people do tend to have underlying infections of Lyme disease or other tick-borne infections, I've always figured, well, hey, let's go after those things, let's treat those things, and thereby unburdening the immune system, so the immune system will have more ability to handle whatever is causing the Morgellons disease. So that's always been the approach really in treating these people, is discovering every possible thing that could be burdening their immune system and trying to remove or handle those things so that the burden on the immune system will be lightened. And that's about the only way you can approach something like this. When you're treating something that you don't know what it is, you just basically have to work on the immune system, helping the immune system. So just by trial and error, I've found that giving various things like antibiotics and antihelminthics have helped these patients. But I can't say for certain why they've helped. Because just because you give an antibiotic and somebody gets better, you can't thereby say, oh, that proves it was a bacteria. Things work for different purposes than for which they were intended. And so sometimes we don't really know what we're doing with the things that we're using.
Do you feel like Morgellons is a biofilm condition, much like cystic fibrosis?
Well, I do think they're probably, yes, I really do think there's biofilms here. We found the alginate, which is one of the primary substances in biofilm, and that has definitely been found in the lesions. And, biofilm is a way that bacteria coalesce, kind of stick themselves together, so that's a safety in numbers kind of a thing, so that they can protect themselves when they're sort of glued together in a mass. And this alginate, it serves as the glue in the biofilm often, and this has been found in the lesions and the exudates from patients, the laboratories that have been working on this. And remember, the few laboratories that have been working on this disease have been doing so out of the goodness of their own hearts. We can't get any significant funding. It's all private donations, and people, scientists, doctors donating their time to work on this. So that's why things are moving so slowly.
Now, that's a result of the CDC study in 2012, correct? We kind of got written off.
That didn't help. That didn't help. Now, of course, I always say the CDC study really didn't find anything. It's just that the media distorted it and made it sound like they found people were crazy. Because very specifically, the CDC study said we were not able to find a biological basis for this. But they did not, by any stretch of the imagination, say that people who have this are crazy. They just said we were not able to find a biological association. The media then took that and sort of wanted to make it sound something. Obviously, it's much more sensational and much more newsworthy to say, hey, all these people that think they have this disease, they're all crazy people. So, absence of proof does not equal proof of absence, basically. Yeah.
And Morgellons is kind of like a ratings toy anyways. A lot of people will tag it on their YouTube video, and I'll see thousands of hits on them, and they really don't have anything to do with this condition.
Yeah. Interesting.
So what do we know about this bacteria? Well, let me back up for a second. How did we find bacteria in these patients? And several times in dozens of patients, but the CDC couldn't find it in any of them.
I know, pretty interesting, huh? The researchers say it's because they use different techniques, and they use different techniques for looking. And Marianne Middleby, being one of the researchers, has kind of said it, and she said it, and everyone laughed, but it's true. In one of her talks, she said, well, the reason we found it is we actually looked for them. And so I don't know how much effort was put into that CDC study. Who knows? But all we know is that using the various techniques that they were using, the researchers who have been working on this in their own time have said it's pretty easy to detect the Borrelia bacteria in these lesions. And Borrelia, is the bacteria that causes Lyme disease. And so other bacteria have been found too, but that was the one that was so intriguing because, okay, here you have all these people with this condition, and a lot of them have Lyme disease. And now we're finding the Lyme spirochete in the lesions of these Morgellons patients. The plot thickens. What's going on here with that connection? I feel it's a leap to say Lyme causes Morgellons. We don't know that for sure, but gosh, there's definitely a strong association there. And what is it? That's what we still need to find out.
So yeah, and that's my next question. This bacteria that causes Morgellons. I understand that there are two main kinds of Borrelia: the relapsing fever and the Lyme Borrelia. Do both cause Morgellons? Can a person have relapsing fever but not the Lyme bacteria and present with Morgellons?
Well, there's a lot of different Borrelia bacteria. And there was a small study done by IGeneX Laboratories in Palo Alto, California, very small, in which they took samples from 10 Morgellons patients. And they did find out that quite a few of those patients were positive for a different Borrelia that causes tick-borne relapsing fever. So the theory is, well, maybe all of these people with Morgellons have some sort of Borrelia, maybe not necessarily Borrelia burgdorferi, the one that's known for causing Lyme disease, but maybe they all have a different Borrelia. So we don't know for sure what this means. Again, this is one very small study. It mainly raises more questions than answers anything. And it raises the question that, okay, maybe it's not Borrelia burgdorferi that's specifically associated with Morgellons. Maybe it is Borrelia and sensulato, as they say, which is Borrelia in the broad sense, which could include different kinds of Borrelias. And see, the reason that that's important is because when people are getting tested for Lyme in the sort of the regular labs, like they go to LabCorp Quest, they're often turning up negative on those tests. And I know people write me all the time and say, I heard about the association between Lyme and Morgellons. My doctor did a Lyme test on me and it was negative. Well, many times those tests will be negative, and they really are only looking for Borrelia burgdorferi in those tests. And so there could be other Borrelias involved in this. There's a lot of false negatives in the Lyme testing that's done in the regular laboratories. And when I say regular, I mean non-specialty labs that are not just looking for tick-borne diseases.
Now, do all Borrelia burrow into tissue, bone, organs, brain, spine?
Yeah, they're corkscrew-shaped bacteria, and so one of their things they're able to do is really penetrate deeply into cells and tissues and the brain, and so they're a hidden kind of a bacteria, and that's one of the reasons it's very hard to detect them and to treat them, because they're not just readily found in the bloodstream. They're more deeply buried into tissues where it's hard to really get to those tissues with, say, oral antibiotics, because it's hard to have enough antibiotic to really penetrate where you need to go. That's why I have found that actually a very high dose oral antibiotics, as high as I can get the patient to tolerate, usually work better. Of course, the problem there is that a lot of people just can't handle it. Their stomach will not handle them taking large doses of antibiotics. But for those who can tolerate it, the high penetration, the high dose seems to be what really, really works.
Well, for me personally, when I take a higher dose of antibiotics, there seems to be the side effect where I lay down to go to sleep for about, and then the whole night or the whole next day. What is that?
Jeremy, I'm sorry, but everything halted for a moment, and so part of your question got cut. So I didn't hear the whole thing. I'm sorry.
Whenever I take a higher dose of antibiotics, I have a side effect where I lay down to go to sleep, I doze off for about 5 minutes, and then I wake up in an extreme panic. I have to get dressed and go for a walk around the block, and I can't sleep all night or the next day. Is this a result of from the antibiotics? Is it from the disease? What can you tell me about this reaction?
Well, I think what happens is the higher dose, the higher the herxheimer reaction. The herxheimer reaction is when people feel worse when they first start to take antibiotics, because it stirs up a tremendous amount of inflammation. And when you have inflammation, you have a high level of cytokines in the body. And one of the effects of these cytokines is making people feel very wired. People will talk about being anxious, stammering, they can't sleep, they have tremors, all of these symptoms of a revved up neurologic system tend to happen in response to having a very high cytokine load. And that will happen when people first start treatment. And of course, the harder the treatment, in other words, the more intense the treatment, the more they will react that way. And so it's difficult. It's very difficult.
So are there any other treatments besides antibiotics in general that, let's say, for example, somebody can't make it to a doctor, but they really want to dry up their sores as best they can? Is there any kind of home treatments that you could recommend, that you would?
Well, Yes, there there is a product that is working really well that is not prescription. That's called High Tape, HY, and then tape. People buy even on Amazon. Now, it does have some cortisone in it, but you put the tape over the lesion. And, actually, injecting cortisone into the lesions does help them heal easier. It's just not many people can find a doctor who's willing to do that for them. So the cortisone really just suppresses the inflammatory response and helps the lesions feel better so they don't hurt as much or sting or itch or whatever, and it helps them heal a little bit quicker too.
That's good advice.
Pardon me?
Oh, that's good advice. What's the name of that product?
It's called High Tape, HY, and then hyphen tape, TAPE. And some people can get some benefit from using even cortisone creams, but usually it's a very short-lived benefit. Most of the topicals don't work that great for that long. I think most people have already discovered that. They work very well at first, and then they just stop working, and who knows why that is. So the topicals, for the most part, have not been all that helpful. I mean, people are always writing me and saying, "Oh, I found the answer. I found this great thing that helps." And I'll say, "Well, how long have you been doing it?" And they'll say, "Well, a week." Well, okay, write me back in another week, because a lot of times it just doesn't keep up.
So what's the worst thing that you've heard people take that could be a detriment to their health?
I don't know if you want me to say those things, because, oh no, it's people have done very, very drastic things and put very strong, lethal kind of insecticides and gasoline and all sorts of things on their bodies. And some people have had some great success. I don't know why, but there are some people that have put these very toxic things on their body and they have felt better. Of course, I do not encourage this. It's a very worrisome thing to do, to have those things absorbed into the system. And I did know one patient who had bone marrow suppression because of the toxic things that she had been putting on her skin. So it's a scary thing to do. But as you and I both know, usually people who have this condition are at a point where they'll try anything. It's just such an awful thing, and the sensations are so awful. They're willing to try just anything, even if it's a dangerous thing. They're willing to try it. And that says a lot about the suffering in these people and why we need to pay more attention to this disease. Because if you've got people out there self-treating by pouring DEET on their bodies or pouring gasoline on their bodies or whatever, I mean, come on, this is some serious stuff. Of course, there are those who would say, well, see, that just is more proof that they're actually crazy and there's nothing wrong with them. So you can always spin it that way,
Yeah, so that leads into my next question. How can a patient really legitimize their condition to their friends and family if they're just dead set against accepting it?
I know, this is what's so hard. And I think one thing that's so important is the language you use. And the nurses in the Charles E. Holman Morgellons Foundation and I are always trying to encourage patients. You have to be very careful about the language that you use. It's obviously there's going to be sensations that you have that remind you of something, or there's going to be things you visualize coming out of your body that remind you of things. But you can't go into a doctor and say, I have a shrimp coming out of my body. You can't say something like that. Maybe you have pink globs and they look just like shrimp coming out of your body. But don't say I have shrimp coming out of my body, or you're going to, somebody's just going to send you straight to a psychiatrist, And so you have to be very careful using descriptive terms. You can say I have exudates. I have things coming out of my skin, and some of them are small and pink and firm, and others are this way, and you have to describe them like that, but not really compare them to something, or not even say things like I have seeds coming out of my body. Don't give them a name, because you don't know that they're seeds. They may look like seeds, and I've seen them. They do look like seeds, but you can't say that. You just say, you have to say, I have the small, firm, white, things coming out of my body that look about like this, or draw a picture, but just don't use those words, because that's what immediately turns off the healthcare providers. They hear that stuff and they just immediately stop listening.
And it's really not the doctor's fault. It's the establishment, isn't it?
Well, you think about how the doctor has usually a very busy day, and they only have 7 minutes to see each patient usually, and if somebody comes in and talking about something very unusual like this, you can understand why they would have a tendency to say, this is something I don't need to pay attention to. But I still think there's a way that it can be presented to family and to doctors, and so that it can be more understood. In other words, it's very difficult to ask patients to do this, because I understand there's a tremendous amount of panic and suffering. But if you could try to stay very calm and just really describe what is happening, like I say, using adjectives, but not using nouns. Don't say, worms are coming out of me. Say long filaments that are I think that you can be taken so much more seriously when you use those kind of descriptive terms rather than using nouns, as I say. It makes it.
Of course, this is always an excellent Christmas gift.
There you go.
Yeah. So how far back can we trace Morgellons in recent history?
Well, I talk about this in my book. I had one patient myself who had it since early 60s. And then his father had it as well. And so I know this isn't, a lot of people will say, oh, this is a brand new thing. It only came about because of chemtrails or whatever, but it's been around longer than that. It's been around longer. So I don't think it is a new thing. I think that it's probably been in third world countries for a long time, and people just have varying names for it. I mean, this one patient I talk about in the book, he had gone to Mexico back in the 70s, and he had talked to healers in Mexico, and they just said, oh, yes, we know about this. We call it cactus man disease, and so, it's just, who knows? I mean, maybe if we go into the deep jungles, into the healers in the jungles, maybe they will. That's what I keep wondering, if there might even be a cure for it by some medicine man somewhere, and deep in the Amazon, or, somebody needs to go in there and find out.
What about cannabis? Is there any legitimacy to it having a palliative effect on this condition?
What about what? I'm sorry?
Cannabis.
Oh, cannabis. Yeah, I think that, that can be a very helpful thing in terms of dealing with a lot of the symptoms, for sure. I don't know, if there's any curative effect, but palliative, certainly, I mean, it can certainly help with a lot of the symptoms, because people do find, as we discussed earlier, they had quite a bit of anxiety and agitation and insomnia, and all of those things can be helped with the cannabis, for sure. So in any states where people are lucky enough to have access to it, certainly something that they should try.
Does Morgellons typically get worse in humid weather?
The symptoms always get worse in terms of what I've had reported to me, my patients. But then again, when I just go in and study skin diseases of various types, the same can be said for pretty much anything that's a skin problem. So why that is, I don't know or can't exactly explain, but people do have worse symptoms in certain weather. And I have patients, I remember one patient I'd had for 20 years, he had had this for 20 years, and he said it waxed and waned. He would be fine all winter, and then every summer he had terrible symptoms. And this had gone on for 20 years for him. And so definitely the hot weather, when people are sweating, when there's humidity, those make people a lot more uncomfortable. But I don't know if that's any different than any other kind of a skin condition, because that seems to be the case with other skin conditions as well.
What about diet? Does eating anything in particular, like gluten or GMO foods, have anything to do with the condition?
Well, I do know people feel a lot better when they don't eat sweets. They take the sweets away from their diet. That really, really seems to help them quite a bit. And then when they do reintroduce them, it aggravates their symptoms a lot. A lot of the patients it's helpful to get off of gluten. But again, see, I think these are all because these are things that just stir up inflammation in the body. And the more inflammation a person has, the more symptomatic they're going to be with any kind of inflammatory condition, and which could include Morgellons disease, as well as all the tick-borne diseases and any number of diseases that have inflammation in the body. So anything we can do, the anti-inflammatory diet is something that I always highly recommend to people, which usually involves getting rid of refined products, getting rid of sugar, of course, any kind of the processed oils, any preservatives, all of those things incite inflammation in the body, and then those are going to make symptoms worse for the patient.
So how do you feel about the Lyme antibody therapy and the new Lyme vaccine that's coming out? Would you recommend that to your patients?
I don't think so, no. I really, I don't think we're going to be able to come out with a good Lyme vaccine. I just feel like that this has been a very controversial topic. When you think about this, Jeremy, you could get Lyme disease over and over and over again. You cannot have immunity to the disease, even based on the fact that you personally have already had it. So how are you going to have an effective vaccine when the whole purpose of a vaccine is sort of trick your body into thinking that you've already had this illness before? But if you can't even have immunity from having had the illness before, how is a vaccine ever going to work? People can get Lyme disease over and over and over again. So I just would feel very skeptical about the ability for us to come up with a vaccine. Now, people always say to me, well, but they have it for dogs. Well, dogs have very different immune systems than we do. And it's true, they do have a vaccine for dogs, and apparently it works very well, but we're not dogs, so we can't use that same vaccine.
Now, the bacteria typically lives in animals and is carried to humans by ticks. But in animals, it doesn't typically have the destructive effects that it does in humans. Is this correct?
Right, that's true. They don't actually, they're not actually sick with the Lyme disease, no. And so, but we are infected by the tick bite. But people often say to me, well, especially when I lived in Texas, I had a lot of hunters they would kill deer, and they were always concerned about eating deer meat. They said, well, if they had all these ticks all over them and the ticks carried Lyme disease, would I have to worry about getting the Lyme from eating the deer meat? Yeah. But no, actually, you don't. First of all, going through the GI tract like that, it wouldn't survive. So that's one thing. And one of the reasons that we get the infection so easily from the tick bite is the tick actually injects an immune suppressing substance to make the body just more able to contract the disease. And so I think that's where most people are getting it. Now, we talk a lot about vertical transmission, mother to child transmission, sexual transmission. There's still a lot of controversy about all of those. But as far as what I've seen just in treating patients through the years, I've seen a lot of, well, I've seen situations where I know for sure there was vertical transmission. In other words, the mother gave it to the baby in utero. And so that's another way that people can contract the disease. There's still a lot of controversy about whether people can contract it through other bites. People have been convinced they've gotten it through horse flies, and I have patients where those were the only bites they had were something like horse flies, and yet they came down with Lyme disease. So there's the conservative view has always been there's only one way to get this, a tick bite. That's it. But I think there's just so many other ways that we probably are going to find out that people can get it through other ways.
Yeah, don't mosquitoes feed the same way that ticks do?
Yeah, well, I think mosquitoes, there are reasons why mosquitoes probably are not carriers of this. But I don't feel qualified to really talk about that. I do know that there's some rationale behind that, but I personally am not qualified to talk about that.
Well, they certainly carry the malaria.
Yeah, that's true. That's true.
Dr. Save, we were winding down to our last few questions here. This next one's a big one too. What is the difference between psychodermopathy and dermatoborreliosis?
Well, the first one, psychodermopathy, is basically, it's a psychiatric condition. In other words, somebody is having itching, somebody is gouging at their skin or whatever, but they're doing it simply for psychiatric reasons. And so that's a psychiatric diagnosis, really. The second one is a term whereby borreliosis, in other words, the bacteria that causes Lyme disease, is found in the skin. Now, we have found borreliosis in the skin of Morgellons patients. So does that mean that Lyme disease, or let's call it Lyme disease instead of borreliosis, is causing Morgellons disease? Could be, but we can't say that for certain, because just because there's the presence of the bacteria in the sick person doesn't mean that that is what's causing it. I always kind of use the example of back in the old days, they used to say chronic fatigue syndrome was caused by Epstein-Barr virus. Epstein-Barr virus is very prevalent. It's in the population. A lot of people have Epstein-Barr virus, probably the majority of people do, and the virus increases in titers whenever the immune system is suppressed. And so they were finding high titers on all of these people, so they immediately assumed that the Epstein-Barr virus was causing chronic fatigue syndrome. Well, it turned out not to be the case. It was just these titers were opportunistic. In other words, the virus was taking advantage of the suppressed immune system. So what we don't know is whether the Lyme bacteria is opportunistic here or whether it is the causative pathogen. But there is the association, which is certainly enough to make us want to go forward and study and just learn a lot more about what the connection here is.
So it's incorrect to suggest that Morgellons is psychodermopathy.
Absolutely. That's my strong feeling. Now, of course, many doctors would disagree with me on that. Most psychiatrists, most dermatologists are still thinking of it as of a psychodermopathy. In other words, a strictly psychiatric condition. I do not believe this. I think anyone who's taken care of as many of these patients as I have can see that there's clearly something physiologic going on here. This is not a psychiatric condition. There may be some psychiatric symptoms, but those are as a result of the infection itself. Those are not the condition. The condition is not a psychiatric condition. And that's what we need, is to make that clearer to the population at large, and particularly the medical community, so that they'll take this disease more seriously and really study it. And study it more seriously than they did with that CDC study, which there were just too many problems with that study. And I think it was a rather ingenuous attempt at solving this mystery.
So is there any easy way to ask your doctor to get this skin test to see if the Borrelia is inside the skin?
Yeah, I don't know. Of course, you first have to get them to pay enough attention to take you seriously.
I mean, if they're already working with you.
Yeah. Oh, if they're already working with you. Well, the problem is that I think that, you know, usually you're not going to find to be the average lab. Let's just say, just any average lab that your doctor uses. I won't name any names, but just the labs that people usually use for most of their stuff. I don't know that they're really going to pick it up. You know, we've been picking it up in research laboratories, and a lot of times research laboratories are able to find things that the standard diagnostic laboratories are not. So I don't know for sure that would be the answer, having them send it off and look for Borrelia bacteria. But certainly it would be a start. If you have a doctor that would pay enough attention to you to do that, of course. I think that first thing that we need to do is have people tested in specialty labs, probably for the Borrelia bacteria, and rather than just using, you know, kind of your standard laboratories, because the specialty labs will use a different antigen soup. In other words, they will look for antibodies to antigens that are present in many different types of Borrelia. And it's we sort of have our blinders on if we're only looking for one Borrelia here. We've got to look at a bigger picture, and that's what's not usually being done in the regular laboratories. If anyone has a doctor who has been sympathetic to them and would like to help them, if those doctors would email me, then I would be more than happy to send them some direction in terms of how to test and what kind of treatments to try. I cannot send that information directly to patients because, you know, I've already been in enough trouble in my days of practice. So we have to be very careful about providing treatment information to people who are not our own patients. But I can provide that to your doctor, or when I say doctor, I mean loosely a nurse practitioner, PA, whoever's taking care of you, and they can email me to Lyme DC, that's LYME, like Lyme disease, and then DC, which stands for District of Columbia, where my office is, lymedc@gmail.com. And then if they will email me, I will be happy to provide them with testing and treatment information. And the good news is that I've been excited about is I have been getting more and more doctors writing to me for this information, which tells me that at least more doctors are getting open-minded enough to know that this is a real problem and not just a psychiatric condition. So that there's some good news there. Very slowly but surely, things are changing.
That's encouraging.
Yeah.
Dr. Staley.
We just wish it would go faster, right?
Right.
Yeah.
What do you like to do to cut loose and relax when you're off work?
Well, I am lucky enough to live most of my time in San Miguel de Allende, Mexico, and that's where I'm talking to you from right now. And it's a very fun place to be. And all we have to do is go outside and walk around, and there's fun all around us. So it's very fun living here in Mexico. I go back and forth, and I still have my office in Washington, D.C. But this was sort of my little way to semi-retire, I guess, a few years ago. And so it's working out well. I kind of have the best of both worlds by doing this.
Yeah, I hear the weather is always nice down there.
Perfect weather all the time, yes.
If you weren't working on Morgellons, where do you suppose your passion would lead you?
Well, I have been very, of course, interested in Lyme disease, and I'm working on a book right now on Lyme disease and treating it. And so of course, I've become passionate about that as well. My other main interest in life has always been music, and so I was a musician before I ever got into this world, and I see myself in the next few years trying to go a little bit more back in that direction of playing piano and singing and writing music, because I think I need that at this point in my life. I've drifted away from it for a number of years.
Yeah, that sounds very therapeutic.
It is, yeah.
Dr. Stavely, I appreciate your time. We thank you very much for joining us here today to discuss Morgellons and the facts surrounding it. And thank you also for giving out your email address where people can contact you. They can have their physicians contact you. And I would like to have you on the show again sometime in the future.
Great. And let me just point out one thing about the email address. I cannot, diagnose people over email or treat people over email. So I really just can't do that. So I know a lot of times people want to email me their long involved story and tell me and ask me to diagnose them. But of course, I can't really do that without examining somebody in person. But I think that if you do read the book, one more plug on that, Jeremy. If you read the book, you'll be able to pretty much diagnose yourself, just if you have the symptoms, because that's the way it's diagnosed right now. It's diagnosed by symptoms. And so if you have the majority of those symptoms that are listed there in the book, then you do have this disease. It's not like we can run a test to see if you have it or not. It's a clinical diagnosis. And so then the hard part's going to be, okay, how can you find somebody to help you? Well, if you can find somebody who's at least empathetic, I am willing to, and there's no charge for this, help that doctor help you. So, and I have found people have the best luck getting back to just maybe their primary care doctor who they've known for years, somebody they have already a good relationship with. It's very hard to just walk in off the street to any old doctor and hit them with this, But if you've known someone a long time, they know you, they understand that you're a sane person trying to make the best of a bad situation, then often those are the ones that are going to be empathetic and willing to help. And I hope that each of you can find somebody like that, because you just need somebody on your team, working with you with this.
Yeah, that's the thing, is anything you do in life, you can't really do it alone.
Yeah. And I just know there aren't nearly enough people out there willing to help these people. The few of us that are, there's just only so many patients we can take on, unfortunately. But if you find somebody who's willing to go there, then I am willing to help them. And, like I say, I'm happy to say there are more and more people, more and more healthcare providers out there who are willing to step forward. And just to give a little plug for nurse practitioners, they tend to be the ones that are a little more open-minded and tend to, if you can find a nurse practitioner, they will often contact me. And they're the ones that are often more open-minded about learning about this and wanting to know how to treat it. So,
commendable effort, my friend. You're definitely a hero.
Thank you so much. Thank you for all you do, Jeremy.
Thank you, Dr. Stavely. You guys be sure to subscribe, hit that bell icon so you can get notified the next time we upload one of these videos. And we'll be looking for comments down below. Take care.